The third aspect of EDDT is really the flow out of hospital, out of the CAPE program and into the short stay transition beds here in our Woodlands environment. And that is in order to move kids that don't need to be on CAPE out into short stay for a transition back to community and some ongoing supports. It also opens up spots on the CAPE program for kids who do need that level of care from the hospital setting.
The short stay program is a voluntary program, so the kids have to want to be here. If they do run away, we are required to call the police and have a missing persons report. Of course, we're going to highly encourage them to stay, but it is a voluntary program. They have to want to be here. Visiting your children while you're here, we actually really encourage that because we want that transition home to family, friends, community. So with the primary goal being transition, we really want them to have visits both on-site and off-site. The short stay program is a treatment program. However, it's not an intensive treatment program like some of the live-in residential programs. The focus for the short stay program really is on the transition to home and community. So we really want you to utilize community supports, and if you don't have those, then that's what we're going to assist you in getting so that you can utilize those in the community. While they may develop skills in the milieu environment here at Lutherwood, it's not specific like individual counseling. They will learn skills, but again, we are really trying to refer them to that community counselor, so we're not replacing that community support. We do a lot of education, parent support, some skill building, things like that. But that intensive individual counseling is not something that they receive in-house, but that we support them to get in the community. The short stay program really is a collaboration between the youth, family, and staff in terms of keeping the youth safe. So we really partner with the youth and try to support them in building coping strategies, making safety plans, and utilizing their strengths in order to keep them safe. And then of course, building on skills while they are here in order to improve their safety. I think it really is that collaboration piece, and we will provide them with support and finding supports in the community for when they go, so that they can feel safe leaving the program. So when they get up in the morning, they can have breakfast, get ready. School begins around 9 here on site, but we would make arrangements for them to attend their community school if that's where they're at in the point of transition. And then during school here, there's a variety of treatment groups. They'd be working on their schoolwork from their home school. If they don't have any school from their home school, then we would ensure that they're either focusing on some similar academics, that they're staying on top of things, or else focusing on learning some different DBT skills and things like that. They would be in school for lunch, then after school they do have some quiet time in their rooms, and then they also have a wide variety of activities in the evenings, whether that be groups or going on outings. They have dinner here, and then they'll settle down in the evening to have some quiet time and settle time before bed. In 10 months between November 2018 and August 2019, there was 0% rehospitalization for youth that entered the short stay and EDDT programs. So I think that really shows that these programs are really supporting the youth mental health.